Beverly Polloway from Santa Ana is about to go in for bariatric stomach surgery at UCI Medical Center. Beverly says she hasn't felt well in years. She's about 5'6" and weighs about 265 pounds. Beverly is considered morbidly obese and has multiple health problems because of it.
I have high blood pressure. My knees hurt now when it comes to, getting up and stuff. Very tired now, especially going up the stairs. We have a 2-story. My feet hurt a lot.
Beverly says her obesity is also causing her to have emotional problems.
Depressed sometimes, sad a lot, embarrassed a lot.
The advantage of the band is that it is very much adjustable and reversible. We can put the band in and we can take it out at a later date.
The lap band and other bariatric procedures are commonly used when all else has failed.
These are oftentimes patients who have tried multiple medical regimens for 5+ years, maybe even decades.
Patients like Beverly, who just want to feel better.
Just a healthier mother for my kids.
In Irvine, David Nazar reporting.
So that's the before of bariatric surgery. Now to discuss the after. I'm joined by George Argyris Jr., a businessman who has undergone the surgical procedure, and his surgeon, Dr. Brian Quebbemann of South Coast Medical Center in Laguna Beach. Welcome, guys. Boy, you two Hollywood handsome guys, I'll tell you. And George, it wasn't always so.
No, it wasn't.
You have lost 200 pounds.
205 pounds, yes, sir.
What's that like?
It's a life-changing deal. It's a life-changing deal. I struggled with weight my whole life and decided on the gastric bypass surgery 4 years ago, did the surgery, and I have relatively had 0 problems since then.
Let's give folks an idea of just what you used to look like.
Oh,
all right,
here we go.
And so let's take a look here. All right, you're the one in the middle.
Yes, that would
with
be
Dan
me.
Lundgren and George Bush, the president. And
yeah, the president
wow.
may not want that picture out, but.
Now, how about you? Now, when you look at that, how do you feel when you look at yourself and you see that?
It's twofold. One, I'm pleased to see that I've changed so much, but that's a depressing picture to look at.
You look happy there. You're smiling. Oh, now look at this. Now here you are. Who's that babe?
That's my new wife, Shannon. Or are you talking about me?
No, actually, no. I was talking about her. Although you look a lot different. And there, look at that. What a contrast.
Yeah.
When you were smiling like that, were you happy? Were you a happy guy?
I think I was pretty happy with everything but my weight.
Mm-hmm.
Yeah.
Okay, doctor. Was there any other way out for George?
I don't think so. I think he had tried everything by that time. I mean, when George came in, he said that he'd worked with a trainer, he worked with a private nutrition coach, he had a dietitian and a cook come in his house, and then he'd gone around the country looking for weight control programs that he hadn't tried. So I think at that point he had exhausted all possibilities.
When folks come into you, are you ready to operate on them, or do you do other things first to see if there's other ways they can lose weight?
Well, usually they don't come in unless they've already tried numerous other ways. And what you really have are 2 criteria that you have to meet. One is the patients have to meet a weight and height criteria that declare them as being morbidly obese, such as the patient you showed earlier and George when he first came in. And the other is they have to have tried a series of weight control programs in earnest to try to lose weight and then failed long run. And if they've done those 2, then they're a candidate.
What makes people morbidly obese?
Eating too much. No exercise. But actually,
easy for you to laugh about it.
Well, actually, there's genetic predispositions that result in people being more likely to develop obesity. But what's really going on is we've got eating patterns in our society that play off of those genetic predispositions, and that's really the problem. So when our patients come in, they're the ones that have suffered the most from those genetic predispositions in combination with our lifestyle.
How about it being an addiction? Is eating an addiction for some people?
Rarely. For the most part, we're not dealing with an eating disorder or addiction like that. There's a lot of people that come in who really have absolutely normal psychological profiles, and when we test them, they're normal. They don't have psychiatric disorders. People have depression, but as that woman mentioned before, it's secondary often to the obesity. And so what we're looking at is essentially people that will test normally just like the rest of the population on a psychiatric profile who have just one way or another developed patterns that resulted in them becoming obese. And so it's hard to identify individual problems that you can correct. And this is why non-surgical weight loss in these very heavy people just doesn't seem to work.
George, some people will recognize your name, George Argyris, famous billionaire businessman, member of the Forbes list. You're his son. Is it easy street being the rich kid?
You know, Rick, it would appear that it would be easy growing up in the environment that I did, but all children, most families have issues that they deal with. Some of them are different than others. Our family had issues. I had issues as a child, and I dealt with them as so many of us do in today's world, and that's through food.
So in your case, do you feel food was an addiction?
Addiction may not be the right word. It was the emotional solution for whatever I had going on inside of me at the time. And that started at a very early age in my life and went all the way up until my mid-30s.
Now that you've had this surgery, do you ever feel that urge that, you know, gee, it'd be nice to just sit down and have a pizza or, you know, a pumpkin pie or something like that?
Well,
I'm naming a few of my favorites.
Sure. And just so you know, I do have the luxury of still having those pizzas and pumpkin pies. They're just in very small portions. The only thing that I can tell you is, yes, even after the surgery, that drive to Del Taco for the double Big Del in the middle of the night to solve whatever emotional trauma was going on inside of me was quickly replaced on the cool list with me standing outside of the car right after the drive-thru throwing the burrito back up. So you just don't have that luxury anymore.
At this point, you just can't be fat anymore.
You just can't do it, no sir.
Now, is there a downside?
You know, there is a downside. The first one, I think, is with a surgical procedure, there's a risk. Second one is there are some inherent things that come along as risks out of the gastric bypass surgery. But for most people, they wouldn't experience this. I think some do. It is a huge life-changing deal, and you end up a completely different body. So maybe the same emotional person, but a different body than you were.
How has it changed your life?
People look at you completely different. People address you differently. People, you know, you're viewed differently by everybody.
Were you aware of that before you had the surgery?
I was not. I led a pretty normal life. I mean, I played basketball, not very well. Dated fairly good-looking women. You know, I water skied, I snow skied, I had good friends, I went to fun places. But in hindsight, it was all greatly reduced by the weight that I was carrying.
Doctor, a lot of talk nowadays about obesity. People say it's an epidemic. I think you referenced it. Is there some hype, to this? Because after all, people are living longer. By many measures, there are more healthy senior citizens than there have ever been. Is it just that this is what we're focused on now?
No, absolutely not. Obesity is probably the biggest epidemic in America today and will probably become the biggest epidemic in the world. It's actually one of the top 10 causes of premature death in the World Health Organization listing, and it's one of the most common causes of preventable death in America.
Let's take a look at the procedure we've been talking about. There's several different kinds, and I do want to warn folks here that this might be unsettling.
Well, what we have there is the intestine. We divide the intestine, and then we connect a portion of the intestine to another portion of the intestine, and we bring some of the intestine up to attach to a much smaller stomach that we create. And what we're doing right here is we're showing a stapling device connecting the intestine together. So that's what you're seeing right there.
When this is done, the stomach is just going to be smaller because it's constricted.
Right. When the whole operation's done, there's a small portion of the stomach connected to the intestine, which is what you were seeing us operate on there.
Okay. As one who always kind of battles his weight, you know, I just want to know, is there such a thing as a good diet? Is there just a good diet people can go on to lose weight?
Well, actually, there is, but I would prefer not to think of it as a diet. People should really look at it as an eating pattern, okay? A diet is very restrictive. So you're saying, I can't have this, I can't have that. And as George just said, he can have pumpkin pie and pizza, just smaller amounts. So it's the pattern and how you eat these things. And I would be willing to bet that George would say he's satisfied with his eating. I mean, that he actually enjoys eating and he's, you know, satisfied with it. I don't think he feels like he's on a diet and that he's restricted. I haven't spoken to him in quite a while, so he could speak for himself on that.
Well, that's easy to say, but how the heck do you do that? How do you get on a regimen, you know? I mean, you eat a peanut butter sandwich, you want to eat the whole thing, you know?
Well, actually what you want to do is you want to eat certain types of food first that result in people having a much earlier satiety, and we teach that after the surgery. And it's easy to do after the surgery, both with the gastric bypass and with the lap band, because what happens is the patients lose their appetite with smaller amounts of food. So rather than focusing on being so hungry, they're focusing on getting food that they enjoy, and we help coach them on what it is of the foods they enjoy to start with.
Finally, George, I understand that drinking is something of a challenge now.
Drinking is a bit of a challenge because of the new plumbing that I have inside of me. And I did not do the lap band. I did the full gastric bypass replumbing. The alcohol basically there's no stomach any longer, and it goes right into the intestines. So it's almost like mainlining alcohol. It's a little tricky at first, but you know.
Okay, well, just don't mainline too much.
Yes,
Congratulations,
sir. Thank you,
Doctor.
Rick.
Great to have you on. The OC Insider is next.